Hello, my friend. I'm so glad you're here. Today in Dizziness, we want to talk about why we need to go slower rather than faster in order to treat dizziness more effectively. My name is Dr. Madison Oak. I am the Vertigo doctor everywhere, and I'm here to help you with all things dizziness and vertigo. Treating dizziness and vertigo, especially in the world of vestibular disorders, is absolutely my thing, and helping you better manage vestibular migraine and persistent postural perceptual dizziness is my number one goal in life, to make sure that you have a handle on your dizziness and vertigo. Now, when you get a vestibular diagnosis and you feel like, hey, there are a lot of things that I can do to change my life. There are a lot of things that I can do to change the way I feel. There are medications and doctors and lifestyles changes and supplements and sleep routines and morning routines. And it's literally like lions and tigers and bears, oh my, out there. There are so many things that you can do, and that frankly, most of them you should do in order to manage your vestibular disorder. Now, what we're actually here to talk about is not all the things you should do, but rather here to talk about how to do them and not feel overwhelmed, because the overwhelm is real. Like I said, there's a bajillion things out there that you could be doing, and even more that you feel like maybe you should be doing. And I got an email the other day that said, hey, I feel like I'm behind. And I replied to that and I was like, honestly, that is the best way to be feeling. Not because you're behind, but because that means that you're taking action slowly. Now, the mindset often happens of, I have this thing, it's going on in my body, and if I just change this 100 different things about my day, I'll feel better. And I was having this conversation with a one-on-one patient the other day. She said, well, my whole day revolves around all of the things that I need to do in order to feel better. And I told her, well, as true as that is, as much as it, yes, is, there are a lot of things that you might need to do to get better, and a lot of things that you might need to do on a regular basis that will help you to feel better. Thinking, what's the thing I need to do next? What's the thing I need to do next? What's this? What's that? What, over and over and over is actually going to help your brain or hinder your brain by making it think, what is it I need to do? I need to fear the symptom. I need to get rid of the symptom. The symptom is scary. I need to get rid of it over and over and over again. And that's actually the opposite of the ideal mindset for dizziness. The ideal mindset for dizziness is, I have a vestibular disorder. It causes me to be dizzy. And here are the things that I do in order to make that dizziness better and not be afraid of the symptom. And those things combined will actually help you to undo dizziness in the long term. Now, going back to my one-on-one patient, I was talking about this the other day. She has actually started to feel better since we are like, okay, in the morning you can do one thing, and in the evening you can do one thing. The rest of the day you have to do things that do not involve your dizziness, whether that is applying for jobs, whether that is going to practice photography, whether that is calling a friend on the phone. It doesn't matter what the things are, so long as they do not have to do with dizziness. Because the more you think about it, the more you focus on it, the more dizzy you are actually going to feel. This is what I call slowing down for faster healing. Again, think of the tortoise and the hare, right? We all heard this story, or most of us heard this story in childhood, where a tortoise and a hare do a race, and the tortoise goes really slowly towards his destination, right? It just keeps walking that way and walking that way and walking that way. Meanwhile, the hare sprints and then takes a break, sprints and then takes a break, goes and visits a friend, goes over here and does this thing. I can beat the tortoise, but in the end, because of the slow, sustainable nature of the tortoise wins the race, right? That is what I want for you. I want you to win this race over time and overall. I want you to sustainably change your life, not a quick fix, but sustainably change your life for the better. And how do you do that? One small step at a time. Use baby steps, think of the tortoise and the hare, whatever it is that you need to do to think about this that will make it sustainable and slow for you is the best way to go about this. So instead of thinking, I will change everything. I'm going to change my whole routine tomorrow. I'm going to do 55 things a day. I'm going to change my entire life. That's going to overwhelm your brain more. So instead of that, I want you to think of one thing a day that you might change for weeks at a time. I'm going to change just my sleep for weeks at a time. I'm going to make sure my blood sugar is balanced for weeks at a time. I'm going to make sure I hydrate for weeks at a time, and then add the next thing in. Do not do this all at once. It will usually cause more overwhelm. and it will be more of a quick fix than a long-term sustainable change. And what I'm here for is long-term sustainable change so you can be less dizzy for the rest of your life. I love you, and I'll see you next time in the next video. Bye.